Hello, my esteemed viewers, this is Medical Science Lecture Room. I'm very delighted to have you here. Today, I'll be sharing with you on the topic malaria in pregnancy. I will share with you on the effects of malaria during pregnancy. Just to inform you, in this channel, I give medical tips or medical education to my esteemed viewers at the comfort of their living room. Again, I run classes for students of physics, chemistry, and mathematics. In case you are new to this channel, please hit the subscription button. Turn on your notification bell so that you won't miss out from any of my videos. Again, like this channel, like this video, share it if you find value. My name is Dr. Godwin Obono. Let's begin. Welcome back. Malaria is responsible for most of the hospital admission in our environment, especially in sub-Sahara Africa. It is a disease caused by a parasite called Plasmodium. And Plasmodium has five species. Therefore, we have 5 types of malaria. We have the Plasmodium falciparum, there is Plasmodium ovale, Plasmodium vivax, Plasmodium malariae, and Plasmodium knowlense. Now in Africa, the commonest cause of malaria is Plasmodium falciparum. What is a vector? How is it transmitted? Malaria is transmitted through the bite of an infected female Anopheles mosquito. In other words, we are trying to say that the bite of a mosquito that is infected could cause someone malaria. What are the effects of malaria? Malaria causes a number of effects. Just to inform you, these effects are most severe in pregnant women. Now, once the parasite enters the body, it traces its way to the red blood cell and causes hemolysis. Hemolysis is a splitting of the red blood cell, which is why malaria causes what? Anemia. Because anemia is reduction in the number of red blood cell or hemoglobin concentration of the blood. Remember that hemoglobin is responsive protein that transport oxygen to the various parts of the cell, various parts of the body. So in anemia, what you have is the level of that protein will reduce and the number of red blood cells will equally reduce. And that's not good for the pregnant woman. It's not so good for everyone that is affected by malaria. But for the pregnant woman, it is really not good because it will not only affect the pregnant woman, it will also affect the growing fetus. So as the woman is anemic, the baby in her womb is also what? Anemic. Remember that anemia, please just to also inform you, it begins from the 16th weeks of what? It can affect the pregnant woman from the 16 weeks of pregnancy. From the 16 weeks of pregnancy, that woman who has malaria may likely have what? Anemia. And now, what anemia does, again, is it makes the woman not to feel like eating. That's what we call loss of appetite or anorexia. And because this woman is not eating, remember, this woman is pregnant. And as she's not eating herself, she will be lacking some nutrient. And as she's lacking some of this nutrient, the baby will equally not have this nutrient. Remember, while the baby is in the womb, the nutrient will be transported or will pass through the placenta from the mother to the womb to the baby. And so if this woman is not taking in enough nutrient, the baby will also not have enough nutrient. That's a very serious consequence that anemia could cause to that pregnant woman, or that malaria could cause to that pregnant woman. Now, as the woman is not taking in nutrient, one of the nutrients that will be affected is what? Glucose. Because of that, there will be low level of glucose in that woman. That's what we call hypoglycemia. And so if the woman is hypoglycemic, therefore the baby will also be what? Hypoglycemic. And what is the consequence? That woman, what will be the consequence of hypoglycemia on the growing baby or fetus? The baby may be underweight. In most cases, you see that the baby may be preterm. It may be delivered before the 9 months or before 37 to 42 weeks of pregnancy. And so again, apart from this effect, sometimes the parasite may infiltrate the placenta as it infiltrates or enters the placenta, it compromises the function of the placenta. Of course, you know that the placenta is responsible for the transport of materials, nutrients from the mother to the baby. And when this Plasmodium infiltrates it, that function is compromised. What is the consequence? The baby again will not be getting the necessary materials from the mother. Further make the baby to be underweight. Also, like I said, preterm is another complication effect on the baby. And again, sometimes that pregnancy may be aborted. That's what we call spontaneous abortion or miscarriage. The woman may have a miscarriage because of what? Malaria, something that is preventable. So you now see that I've identified preterm. I said again, the baby may be underweight because emphasis is on the baby. I've talked about also that the fact that the pregnancy may be aborted. You also may have what we call cerebral. Most serious effect may be cerebral malaria. That again on its own is very dangerous. So there are many of these effects that the malaria could cause to both the pregnant the woman and growing the baby. So that's why it is important. It has to be taken very seriously. Malaria should be taken very seriously, especially during pregnancy. Now, if this woman is infected, how would you manage or treat it? That woman, of course, you should know that during pregnancy, women are not supposed to take drugs indiscriminately, especially during the first 3 months of pregnancy, what we call the first trimester. Pregnancy is divided into three. We have the first trimester, which is the first 3 months, the second trimester, which is from the 4th month to the 6th month, and the third trimester, which is from the 6th month to the 9th month. Now, intake of drugs is very risky during the first 3 months because that's the period the baby organs are forming. That's what we call organogenesis. So the drugs that must be taken any drug that must be taken must strictly be supervised by what? A healthcare provider or your doctor. Now, you see, for malaria, for you to treat malaria during the first 3 months, now there is this drug called ACT, artemisinin combination therapy. Now, of course, that is the drug of choice for the treatment of malaria generally. And of course, ACT, we have about 4 combinations. We have the artesunate lumefantrine. There is also artesunate amiodarquine. There is artesunate mefloquine. There is dihydroartemisinin and peparaquine. Now, these are the 4 combinations. But of all these combinations, it is only the artesunate and lumefantrine that can be used in the treatment of malaria during the first trimester, the first 3 months of pregnancy. Please, you do not give the other combination during the first 3 months of pregnancy. But after the first 3 months and the woman has malaria, you can actually use the other combination to take care of the infection. Again, there is quinine. Quinine appears to be a drug of choice, a drug that can be used to treat malaria in all the trimesters, at any stage of pregnancy. But quinine itself has its own side effect, for which many persons subscribe to ACT. But I emphasize again, ACT can only be given during the first trimester for the combination that has artesunate and lumefantrine. Then this is how you can treat this malaria. But how do you prevent? It's best to prevent the infection. How do you prevent the infection? First, antenatal care. It's advisable for every pregnant woman to go for antenatal care. A very quality antenatal care will help a lot, because from the very moment your healthcare provider will try to follow you up to the day you will give birth. The issue of malaria will be taken care of as well. So also health education is very, very important. More importantly is what we call intermittent preventive measures of malaria. It's expected that for every pregnant woman, as far as the malaria endemic area is concerned, like I said, in Africa, especially sub-Sahara Africa, there is risk for every pregnant woman to have this infection. For that reason, it's recommended that every pregnant woman takes anti-malaria drug, the one that has sulfadoxine and pyrimethamine. Again, the malaria drug that has sulfadoxine and pyrimethamine. Remember, in this case, the woman is not sick of malaria yet. but because there is high risk that she can be infected of malaria, because malaria is common in our environment, it's advisable to prevent effect on the growing baby in her womb, that woman take this a malaria drug, anti-malaria drug that has that combination. I take that combination again, sulfadoxine and pyrimethamine. You find that in Laridox. You find that also in Fancida. So when that woman takes that drug, no, usually you take one in a month, the next month, like that. So once you take, it's a single dose drug. Once you take that drug, it's you're sure that even if you have the bite of what an infected female Anopheles mosquito, there will be no infection. So please take, very, very important, that combination. Then another thing is the use of insecticide treated nets during pregnancy, or even at all times, but emphasis again is during pregnancy, because you have another baby, another human being in your womb that is not matured enough to cope with what the effects of this of malaria, for which it is very, very important that you receive adequate attention when you are pregnant. So once again, in case you have any question, in case you have any comment, please drop them at the comment section. Also subscribe to this channel, also turn on your notification bell, like this video and share it if you find value. Thank you.